Hi, my name is Dr. James Cesare. I'm a surgeon at the Breast Care Center at Mohawk Valley Health System. The symptoms that women may present with for detecting breast cancer, actually most women present without any symptoms at all. If they do have symptoms, usually they may feel a lump in their breast, they may feel some thickening or some changes that don't seem to be the same on either side. Sometimes they can have skin changes with some dimpling, some redness, or some rash that doesn't go away. And they may even present with nipple discharge, and bloody discharge is usually the most concerning. So one of the most important things I tell my patients is that they should do self-breast examination. I tell them to check themselves once a month, usually just on the first of the month. Try not to time this with anything. And look for any of those signs that we mentioned, or any changes that they see or perceive. And if they do feel or find something, they should always call and have their doctors check them. So when should women have their screening or get checked? We go by the NCCN guidelines, and usually women by the age of 40 should start having mammograms, and we recommend them once a year. We do other testing, including ultrasound and other imaging, depending on the findings, but usually starting at the age of 40. If a patient has a family history or is at increased risk of breast cancer, then we usually start earlier in their 30s, maybe even 10 to 15 years prior to the age of 40, if they had a family member or first-degree relative that had breast cancer, say in their early 40s. So we go back even further to start for those types of patients. So what causes breast cancer? Well, actually, we only know two actual causes of breast cancer that we can say for sure. One of them is if a patient had a genetic mutation, and the second is if they were exposed to massive radiation, like if they lived near a nuclear reactor or power lines, or if they got massive radiation to their chest, like if they had lymphoma when they were younger. It's not often done anymore, but those types of patients we know can develop breast cancer. The other risk factors for breast cancer are things like increasing age. As women get older, their risk factor goes up and they have a higher chance of developing breast cancer. If they have a genetic mutation, as we suggested, if they're nulliparous and they haven't had children, there's a slight increase in risk of breast cancer. If women have a very early menarche and in a late menopause, those women are also at risk because their estrogen exposure is over a long period of time. Some other risk factors that are subtle, but they are there. If women are very inactive, they're obese, they have poor diet, these things tend to increase their risks of breast cancer as well. Hormone replacement can be a risk factor if it's taken over a longer period of time. So these are just relative risk factors that we also consider. It's often asked whether birth control pills can affect your risk of breast cancer. And actually, we know for a fact that estrogens themselves do not cause breast cancer. The fact is that if you take them over a longer period of time or add estrogen or exposed to estrogen, if a cancer were to develop, then those estrogens, those extra estrogens, could also influence the rate of growth, or they can accelerate the rate of growth for breast cancer. But they do not cause breast cancer. So as far as dense breasts are concerned, I think there's a little bit of a misconception. You hear it very frequently that dense breast tissue increases your risk of breast cancer. Well, dense breast tissue does not cause breast cancer, and it never has. What happens if you have very dense breast tissue, as is measured on a mammogram when you see a lot of thickening or glandular growth, all that does is it could hide breast cancer and make it undetectable early on. So that's why we advocate in women with dense breast tissue to do additional imaging like ultrasound or MRI, because what we're doing is looking to uncover something that may be hiding. But dense tissue itself does not cause breast cancer. So the question of whether or not breast cancer can be cured, and the answer is yes. And the key to this is early detection saves lives. So detecting something early, finding it on an exam, finding it on a mammogram or an ultrasound as early as possible almost assures, survival, if not cure, in the majority of women that we see today. The new advances in technology as far as mammogram and ultrasound and MRI have made it easier for us to detect breast cancer early, and certainly that's advantageous for women that are newly diagnosed. The new treatments, the research and the development of new drugs and chemotherapies, immunotherapies, targeted therapies, these have all added to our armamentarium to help fight breast cancer and cure it in many women in many stages, not just early cancer stages. Over the last 2.5 decades, because of these new advances in technology and in treatment and in surgical approaches, we have seen the mortality or the death rate in cancer drop dramatically. So if you look at all cancers that affect women, breast cancer today is the only cancer that the death rate has dropped dramatically. So yes, women do get cured of breast cancer. Survivorship is very high, and most women can expect this to not be a death sentence if you're diagnosed with breast cancer. So another valuable piece of information is that if you find yourself with something that you've detected or you're very unsure, have a high risk profile or a strong family history, you can come to the Breast Care Center here. Patients don't necessarily need a referral to come in. You can just call and make an appointment, and we see everyone.